Welcome to the composite tray setup. So I will be reviewing all of the armamentarium we will need to do a composite or a white filling. So we have our disposables, our HVE or high volume evacuator. This suctions up all of the debris and tooth, decay, anything that needs to be rinsed out of the mouth. We have our saliva ejector. This is a slow speed suction used for water and saliva. And then we have our air water syringe tip used to rinse and dry the tooth. We have our Vaseline. This will be used to lubricate the patient's lips. Our topical anesthetic. This is the numbing gel that gets the injection site numb. Then we have the anesthetic syringe. So it's been set up with the appropriate anesthetic and needle. We have our blue etch. The etch will roughen up the surface when we go to place the filling, and we will rinse it off. And after that, we'll place our bonding agent or our glue, if we wanted to use a more simple term. This helps the filling material stick to the tooth. So we'll apply our etch, roughen up the surface. We'll apply our bonding agent or our glue. And then we will use composite or the white filling material. So we have a flowable here and we have a packable. The flowable is more viscous and more liquidy, so it tends to go down into the crevices of the tooth better. So we'll put a little bit of flow down into our prep, and then we'll place the packable next into our prep. We have floss. If we were doing an interproximal filling, we would floss at the end of the procedure. We have our curing light. So this is used to set up the bond. It's also used to set up the composite material. We have our forceps and our pliers that go with our sectional matrix here. So if we were doing a filling in between the teeth, we will set up our sectionals to help build our walls. We have our high-speed handpiece with a 330 burr, and then we have our slow-speed handpiece with a round burr. High-speed is going to be more aggressive, and the slow-speed moves a little bit slower, getting out decay or doing any polishing. We also have a couple of other burrs here for finishing our filling, and we have our isolite to help provide isolation. And we have all of our instruments. The instruments for the composite procedure will include the mouth mirror, the explorer, the cotton pliers, and depending on the doctor or the operator and when they're placing the fillings, they have a variety of different instruments they like to use. Common ones will include a condenser, a paddle, an acorn, or a ball burnisher. In subsequent videos, we will go into the instruments and their uses. And lastly, we have our articulating paper holder, which we'll use this to check our bite at the end. With all of this setup, we are going to be able to complete a filling start to finish. When setting up your operatory, I always like to put my supplies in the order I'm going to use them because it helps me remember. And you want to have everything out that you may possibly need to avoid having to get up during the procedure. So reference your skill sheet and make sure you have all of your armamentarium before beginning the procedure.